There are some new questions tonight about how the coronavirus spreads. The World Health Organization announced this week asymptomatic patients may not be driving the spread, but not all doctors agree on this. Infectious disease expert Dr. Faiqa Cheema from Hartford Hospital joins us now to try to clear things up. Doctor, thanks a lot for joining us today.
Thank you for having me.
So first, can people who are not showing symptoms spread the virus? What's the latest thinking?
This is a question that's come to the forefront due to the recent statement made by the WHO Health Organization. The best way to understand it is to talk a little bit about viral replication dynamics. So I'm going to break it down very simply. What we do know, and it is confirmed, that the virus replicates at least 24 to 48 hours before COVID-19 symptoms develop. It peaks at about 3 to 4 days, and then it starts to drop. It is during this pre-symptomatic or asymptomatic phase, followed by the symptoms that start, where we see most of the transmission that can happen. And this can occur exponentially if we are in an enclosed, crowded spaces with poor ventilation.
Is that similar to how the flu spreads? Is that the same way, or are they different?
The only difference is that, with the SARS virus is that the symptoms specific to the coronavirus start a little bit early. With the flu virus, is usually the symptoms start and then the spread occurs. So it's like comparing apples to oranges. What's hard about the coronavirus is that we think that the transmission occurs before symptoms start, which is why it's so much harder to contain the virus and track it.
So what are the best things we can do to try to protect ourselves and others, even if we don't know if we have the coronavirus?
Until we have a safe and effective vaccine and we have some form of reasonable treatment, the best course of action we have are non-pharmaceutical interventions, which includes wearing a face mask, maintaining some level of physical distance as best as possible, and observing good hand hygiene to mitigate the spread of the virus.
Dr. Faiqa Cheema from Hartford Hospital, thanks so much for joining us on the news today. We hope to talk to you again soon.